Testosterone, often labeled as the male hormone, plays a crucial role in the health and well-being of both men and women. Produced primarily in the testes in men and the ovaries and adrenal glands in women, testosterone is responsible for a wide range of essential functions that go far beyond reproduction. Let's take a closer look at the significance of testosterone, its key roles, and how to maintain its optimal levels. What is testosterone? Testosterone is an androgen, a group of hormones that contribute to the development of male characteristics. However, it's a misconception that testosterone is exclusive to men. While men have significantly higher levels of this hormone, women also produce it in smaller amounts. In both sexes, testosterone is a critical player in maintaining overall health, energy, and vitality. Key functions of testosterone: muscle growth and maintenance. Testosterone promotes protein synthesis, which is vital for muscle growth and repair. This is why higher levels of testosterone are associated with increased muscle mass and strength. Bone density. This hormone plays a key role in maintaining strong bones by encouraging the production of bone tissue and reducing the risk of osteoporosis, particularly in men as they age. Energy and stamina. Testosterone influences energy levels and overall physical endurance, helping you feel more active and capable of taking on daily challenges. Sexual health. In men, testosterone is essential for sperm production, libido, and maintaining erectile function. In women, while the hormone is less abundant, it still plays a vital role in maintaining libido and sexual satisfaction. Mood and mental health. Testosterone impacts neurotransmitter activity in the brain, helping to regulate mood, reduce anxiety, and enhance feelings of well-being. Fat distribution. Adequate testosterone levels ensure a healthy distribution of body fat, particularly in men, preventing excess accumulation around the midsection. Testosterone imbalances. An imbalance in testosterone levels can have noticeable effects on physical and mental health. Here's what happens when levels are too low or excessively high. Low testosterone, hypogonadism. Low levels of testosterone can affect both men and women, leading to symptoms such as fatigue and reduced energy levels, loss of muscle mass and strength, increased body fat, especially around the abdomen, low libido or sexual dysfunction, mood swings, irritability, or depression, difficulty concentrating or memory problems. Common causes of low testosterone: aging, levels naturally decline with age, chronic stress or illness, certain medications like steroids or opioids, lifestyle factors such as poor diet, and lack of exercise. Medical conditions like diabetes, obesity, or hypogonadism. High testosterone levels. Excess testosterone is less common, but can occur due to conditions like polycystic ovary syndrome, PCOS, in women, or as a result of anabolics, steroid abuse in men. Symptoms include acne and oily skin, aggressive behavior or mood swings, excessive hair growth in women, hirsutism, infertility. Maintaining healthy testosterone levels. Whether you're trying to boost low levels or maintain hormonal balance, these lifestyle changes can help. Strength training and regular exercise. Resistance training, like weightlifting, is particularly effective at stimulating testosterone production. Combine it with cardiovascular exercise for overall health benefits. Balanced nutrition, protein, supports muscle repair and hormone production. Healthy fats include sources like avocados, nuts, and olive oil to aid in hormone synthesis. Micronutrients. Zinc and vitamin D are crucial for testosterone production. Shellfish, seeds, and fortified foods are great options. Stress management. Chronic stress leads to elevated cortisol levels, which can suppress testosterone production. Practice stress relief techniques like yoga, meditation, or deep breathing. Adequate sleep. Most testosterone production occurs during deep sleep. Aim for 7 to 8 hours of quality rest each night to optimize hormone levels. Avoid excessive alcohol and smoking. Both habits can interfere with testosterone production and lead to imbalances. Maintain a healthy weight. Obesity is linked to lower testosterone levels. Losing excess fat, particularly around the abdomen, can help restore balance. Medical treatments for low testosterone. If lifestyle changes aren't enough, medical treatments may be necessary. These include testosterone replacement therapy, TRT. Administered through injections, gels, patches, or pellets, TRT can help restore normal hormone levels in men diagnosed with hypogonadism. Medications. In some cases, drugs that stimulate the body's natural testosterone production may be prescribed. Consultation with a specialist. Always seek guidance from a healthcare professional before starting any treatment to ensure it's safe and appropriate for your condition. Testosterone is more than just a masculine hormone. It's a key player in overall health and well-being for both men and women. By focusing on strength training, maintaining a nutritious diet, managing stress, and prioritizing sleep, you can naturally support healthy testosterone levels and enjoy a more vibrant life. If you suspect an imbalance, don't hesitate to consult a healthcare provider. Hormonal health is too important to overlook,